You're a pre-medical student and you're concerned about our health system. I'm an emergency doctor and I'm committed to health systems transformation. Let's talk. Look, the most important question that you will have to ask yourself as you embark on this journey to become a doctor is, will you excel in the current flawed, outdated health system and exploit that health system for your own gain? Or will you excel in the current flawed, outdated health system and transform it? I'm an emergency physician. I've been practicing community emergency medicine for about 18 years. I did well on all my tests, MCAT and USMLE, and got accepted to DO and MD schools. Ended up going to the DO route because of a business decision with my wife. Did residency at the Medical College of Wisconsin, did well there. And I got a master's in public health from Johns Hopkins. I published in leading academic journals like The Lancet on health systems transformation. And I'm currently writing a book, a true story about physicians in the 1890s and their efforts around health systems transformation. I tell you that just so you can get to know me and get a feel for whether you can trust me or not. I'm going to share 5 key steps, 5 keys for that you can apply as a pre-medical student to put yourself on a journey on the pathway to transform our health system. The first one's got a bunch of details under it. I think 6 different areas of focus. So the first one is, you'll have the desire to major in something, art, or in my case, it was philosophy or bioengineering or architecture. Don't. I recommend that you major in health systems transformation. Now, there likely won't be a major called health systems transformation at your undergraduate institution. So you'll have to make it up, or you'll have to create a major. I recommend that the major give you the knowledge, the tools, and the perspective in a deep way so that you understand the major drivers of the system, how we ended up how we are today, and the importance of social change so that you can be a leader, a catalyst, a trailblazer in transforming our health system. So the first key to understanding how to transform our health system is understanding what drives health. So you're going to have to study epidemiology and understand that 80 to 95% of factors that it can improve our health are outside of the healthcare system. So there are things like social interaction and diet and exercise and social justice and our environment. So the second part of this major, or this area of study that I recommend, is that you understand health as a complex adaptive system. So when in the late 1800s and early 1900s, when the current structure of our medical education system and our healthcare system was being established, there was a mechanistic, reductionist understanding of the world, meaning that the world or health or our bodies are like a machine. And if we can just understand the minutia of each part, then we can fix the whole. Whereas we are understanding now that, number one, health is a social system. So we've got people that learn over time, and they've got biases and assumptions that are wrong or partially wrong, and they change their minds. They've got feelings and get jealous and all the things that come along with being humans. So it's a human system, and it's an adaptive system where the parts, the physicians and nurses and hospitals, change over time. And we also relate with each other over time. So as we understand health is a complex adaptive system, I recommend that you Google that term. I can talk about it more in my videos here, but I think you need to really understand the idea of a complex adaptive system. Number 3, you need to understand the role of finances and profits in the history and current state of our healthcare system. So from private equity to fee-for-service to pharmaceutical companies, there has been a significant negative impact by profits. Number 4, you need to understand how social change happens. So you need to study and understand from women's suffrage to the LGBTQ movement to the founding of our country, there have been major changes in our societies that we can learn from and be inspired by and motivated by as we strive to change our health system. Number 5, you need to understand that our current licensing and board certification and diploma and graduation requirements are based more on outdated requirements than they are on actual competency. Just think of, for example, a nurse practitioner that excels in her oncology clinic for 20 years, and she's learned and grown and has excellent clinical skills with her patients, and then she wants to become an oncologist. It makes no sense whatsoever for her to go back to medical school for 4 years and then 3 years of internal medicine and then however many years, 2 years or whatever of oncology fellowship. Within a year or 2 or 3, she could gain the knowledge and expertise. And that would be a major savings for our system as well as for mental health. I've made videos about that. Number 6, you need to understand the history of our system and specifically the role that physicians have played. Whether it be racism or in politics, physicians have often played a role that has been damaging to our health system. Number 7, you need to be able to identify and recognize examples today of people and organizations that are transforming our health system. Number 8, equity. You need to understand that people are born in unfair circumstances that are out of their control, and so they have impacts on their health that are just unjust and unfair. And our system should be set up so that everyone has an equitable chance for optimal health. Finally, you need to understand statistics to critically read and analyze scientific and medical literature and be able to communicate that with colleagues, with patients, with society at large. Okay, so that was all the first key to transforming our health system as a pre-medical student. And that was, again, understanding our health system, the history, the economics, etc., so that you can play a role in transforming it. Number 2, you need to set aside your preconceived notions that you have about what it means to be a physician, what it means to gain education, what it means, your political views. I'm not saying you abandon them, but you just set them aside because we are all influenced by our upbringing. We're all influenced by groupthink. We're all influenced by tribal instincts. And so in order for us to be successful at transforming our health system, we need to be humble. We need to be open to new ideas. We need to be able to collaborate and learn from people that have ideas that are different than we are. We need to understand that this is a different age. With the internet, with artificial intelligence, with the knowledge base that we have today, it's a completely different world than it was in the 1890s and 1900s when our health system was established. So 1, 2, 3, you need to connect with those that have similar views. So I would estimate that about 1% of healthcare professionals, 1% of students, 1% of faculty, 1% of society has a passion for health systems transformation to the extent that they're doing something about it. In a way that, in my view, will lead to positive transformational change. So you need to find those people and you need to connect with them so that you can learn from each other and mobilize and maybe form a club or advocate for a new major or learn from a mentor, things like that. So number 1, 2, 3 is connect. Number 4 might be the most important. So this is all about health and health systems and well-being. So you and I, we all need to be well. So we need to get good sleep. We need to eat a good diet. We need to get exercise. We need to connect with loved ones. We need to engage in hobbies and recreational activities that are positive. And that's going to be super hard because you're going to be in the boat. You need to rock the boat. You need to build a new boat, and you need to do all that without falling out of the boat and drowning. A quick comment about that is if you choose to follow this path of health systems transformation, you may not get accepted to medical school. And that is perfectly fine because you will have gained all this knowledge and perspective and tools so that whether you become a lawyer or a journalist or a public health professional, or a physician's assistant, or nurse, or an architect. I mean, no matter what you go into, having this knowledge about our society and our health system will be a positive development. Number 5, you obviously need to excel in the classes. So you need to learn organic chemistry, even though organic chemistry is not really relevant anymore to becoming a doctor. So you need to play the game, and you need to excel at the game so that you can move on and get accepted to medical school and work on transforming it. This video is, I consider it an informal conversation with the public through the internet. So I'm very happy to clarify or correct. I'm open to criticism. I hope that you'll join me on this journey. I hope that you view this as contributing to a movement, that you learn from other social movements. And then finally, as we think about Johns Hopkins, this was a time when there was a tremendous need for transformation of the entire system. And the planners for and organizers for Johns Hopkins Medical School didn't go to Harvard and get the most seasoned, experienced physician to teach at this new medical school. They got kind of misfits. They got young physicians in their 30s and 40s, William Osler and William Halstead, and a couple of others who had flaws. I mean, one was addicted to cocaine, and another, William Halstead, didn't do well in his undergraduate studies. So they got brilliant, innovative physicians who would challenge the status quo and would have the courage and motivation to create a new medical school. And then the physicians that graduated from Johns Hopkins went around the country, and it contributed to a transformational change. I think you can do the same. I think we can do the same. So I hope you'll engage with these ideas, and thank you.